By identifying these principles of persuasion, you can actually better influence people to make any various kinds of decisions. First and foremost, is what you're trying to tell a person or use the principles of persuasion with true? Is the information you present accurate and honest? The approach should feel genuine and not manipulative. One of the good principles of persuasion that can be used in marketing is what's called scarcity. The contrast principle is a psychological principle that explains how people's perceptions are formed through comparison. It states that when people experience similar things in succession or simultaneously, they evaluate the second thing by comparing it to the first. Presenting the do-nothing option is actually very powerful and very educational for patients in a way that dental school never taught us. By strategically presenting treatment options, you can utilize the contrast principle to enhance patient understanding and increase acceptance. A public commitment is simply something that a patient has stated that is a belief of theirs. What's a common one? I don't want implants. Sure. For whatever reason, their cousin or their sister or their brother had an implant, or they saw it on the news that they are the devil and they don't work and they're very expensive. Essentially, this is where the rubber meets the road. You are trying to figure out the best option that works for them, satisfying their goals, and also the option that works in their budget if budget is important to them. Think of the contrast principle as a staircase, with each step representing a different treatment option. When you start with the anchor, all of a sudden, it's like, I'm getting most of what I want. And it ain't $50, $60, or $70,000. If you do nothing, expect the disease to get worse. Expect the pain to appear or more teeth to break. Expect root canals or more root canals or implants to be necessary in the future in order to maintain your teeth. They don't know what dentistry costs, so they're going to compare it to other parts of their lives, and that is an ineffectual comparison. It's apples to oranges. You want to start with the best and then move down, because people will compare against the last thing that you told them. Many patients fear pain more than you even think. Assume it's everyone. I have many scared boomers in my practice who have a knee on the chest story or a Novocaine doesn't work story. I will have patients who are in their 60s, even 60s, 70s, and 80s, and they will look me in the eye and they say, "Doc, what is the point of me fixing my teeth or me replacing these missing teeth if I'm going to be dead soon?" I have so many patients that don't give a crap about their dentition until the social six is affected. Literally, they'll have no other teeth in their mouth. The minute number 8 breaks, I'm ready to go. If somebody talks about how much they love barbecue and they're missing all of their teeth on the left-hand side and they're going to start to break number 30 on the right-hand side, yeah, it's pretty important to maybe keep some of those teeth so they can continue their quality of life. If we wait, eventually we'll lose the tooth and have to replace it with an implant or a bridge, which costs double this fee. One thing that science has shown us is that people retain the last thing you tell them far better than the first thing. So start with the bad news, end with the good news. By understanding the contrast principle and effectively using anchors, you can empower your patients to make informed decisions about their dental care.